Did you know that you might be at risk or might have diabetes? According to the Center for Disease and Control, there are 29.1 million or 9.3% of our population have diabetes. That is roughly around 1 in every 11 people have diabetes. In the website, in the article that I've read in the American Diabetes Association, it was listed as the 7th leading cause of death in 2010. After you have listened to this, you will know how serious this disease is and why this disease should not be taken for granted. Because I will be discussing what is a diabetes, what are the types of diabetes, what are the risks of diabetes, what are the signs and symptoms of diabetes. What is a diabetes? Diabetes is a disease in which blood glucose level is above normal. That means your blood glucose level should be 130 mg per deciliter below. That is taken in the morning with nothing to eat yet. Our pancreas produces insulin. This insulin helps the blood glucose to get into the cells for us to use as energy. If our body doesn't produce much insulin, this glucose stays in our blood. As discussed in the book of Basic Nursing by Ross Dahl, there are 3 types of diabetes. Type 1 diabetes is the insulin-dependent diabetes. The onset of this is juvenile. The second one is type 2 diabetes, also called as non-insulin dependent diabetes. The onset of this is when you are 30 years of age or more. And the third type of diabetes is gestational diabetes. This occurs only to women during their pregnancy. What are the risks of having diabetes? Because number 1 is obesity. The second one is family history. The third one is prior history of gestational diabetes. The fourth one is older age. The fifth one is physical inactivity. The sixth one is race. It's either because you are Hispanic, African American, Native American Indian, or you're an Asian or Pacific Islander. Now, what are the signs and symptoms of diabetes? The signs and symptoms of diabetes are frequent urination, excessive thirst, unexplained weight loss, extreme hunger. If these symptoms were prolonged, this will create a complication. And what are those? The complications are the following: blindness, heart disease or heart hypertension, kidney failure that would require dialysis, and the worst one is leg amputation. Now, how do we treat or prevent diabetes? The first type of treatment of diabetes is diet and exercise. The second one is oral medications such as glipizide, glyburide, metformin, and among others. But take note that these oral medications puts you at risk for having a liver or kidney damage. The third type of treatment is insulin, the Humalog, Novolog, Levemir, or Lantus. And this type of treatment puts you also at risk of having an infection because you need to inject it into your body. Now, if you think you're having signs and symptoms of diabetes or you are at risk, you need to consult your doctor immediately and be properly screened. Remember, the goal is to prevent, manage, and extend the quality of life. Together, let's fight this disease. Let's lead our families to a healthy lifestyle. Thank you for your time, and I hope this topic is beneficial to you and your loved ones.